Look at your ankles right now. Are they swollen, puffy? Does your skin feel tight, almost like it's being stretched from the inside? Do your socks leave deep dents in your legs that take hours to go away? If you answered yes to any of those, stop what you're doing and watch this entire video. Because what you're experiencing is not normal aging. It is not just water weight. It is your vascular system sending you a distress signal. And if you ignore it, it can progress into something genuinely dangerous. I'm Dr. Michael Kent, and in the next few minutes, I'm going to walk you through a complete 7-step nighttime protocol that addresses the real root cause of chronic leg swelling, not just the symptoms. A protocol that, when done consistently, helps your body drain, repair, and rebuild your circulation while you sleep. Here's what most people get wrong about leg swelling. They think it's just salt, or heat, or standing too long, so they cut back on sodium, prop their feet up for a few minutes and call it a day, and the next morning, still swollen. That's because those approaches only address the surface of the problem. The real issue is something called chronic venous insufficiency, a condition where the one-way valves inside your veins weaken and stop working properly. Blood that should be pumping back up toward your heart starts pooling in your lower legs instead. That stagnant blood creates pressure. That pressure forces fluid out of your capillaries and into the surrounding tissue. And that fluid becomes the swelling you see every single evening. And here's the part nobody tells you, that pooled blood is the exact environment where dangerous blood clots, deep vein thrombosis, or DVT form. This isn't cosmetic. This is circulatory health, and tonight we fix it properly, 60 minutes before bed. Before you do anything else, you need to address what's happening at the cellular level, because your swelling may actually be driven by a mineral imbalance, not just circulation alone. Your kidneys manage the majority of your body's fluid balance, but they need a precise ratio of 3 key electrolytes to do their job: sodium, potassium, and magnesium. When you're low in potassium or magnesium, which most Americans are, your cells cling to sodium, and sodium pulls water with it. That's extra fluid that ends up right where gravity sends it, your ankles. Here's the fix. Magnesium citrate, approximately 300 to 400 milligram or 1 teaspoon, mixed into 12 ounces of water. Magnesium is a natural smooth muscle relaxer. It eases tension in your blood vessel walls and supports proper cellular hydration. Drink this slowly. Now here's the secret addition, a generous pinch, about 1 to 4 teaspoons of cream of tartar. Yes, the baking ingredient, cream of tartar, is one of the most potassium-dense natural sources available. Potassium works directly against sodium at the cellular level, signaling your cells to release excess fluid. Drink this combination, 60 minutes before bed. The timing is intentional. You want your kidneys actively processing that excess fluid while you're still upright, while gravity is still helping, not working against you. Important note. If you have a kidney condition or are on blood pressure medication, consult your physician before changing your potassium intake. For everyone else, this is your foundational first step. This one surprises people, but it is hands down the fastest way to manually flush stagnant blood out of your lower legs. It's called contrast hydrotherapy, and it works by triggering something called the Hunting response, a rapid cycle of vasodilation and vasoconstriction that acts like a powerful mechanical pump for your veins. You'll need 2 basins. Basin 1. Water as warm as you can comfortably tolerate, hot but not scalding. Basin 2. The coldest tap water you can get, with 5 to 6 trays of ice added in. Hot water, 3 minutes. Your veins dilate wide open. Stagnant blood and fluid are drawn toward the surface. Cold water, 60 seconds. Your veins clamp down hard. That contraction squeezes the pooled fluid out and pushes it back into your central circulation. Repeat this cycle 3 times total, and always finish with a final 60 seconds in the cold water. That last cold plunge is critical. When you pull your feet out, your body responds with a powerful, reflexive vasodilation. A surge of fresh, oxygenated blood rushes in to warm the tissue, carrying waste fluid away with it. Breathe through the cold. It's uncomfortable for a reason. That discomfort is your veins working. Quick note, if this content is helping you, hit that subscribe button right now. Dr. Michael Kent posts new vascular and circulatory health protocols every week. You don't want to miss what's coming. Your calf muscles are sometimes called your second heart, and for good reason. Every time they contract, they squeeze the veins running through them and push blood upward against gravity. The problem with simply elevating your legs on a pillow is that it's passive. Passive elevation is slow. We need active drainage. This technique is adapted from the yoga pose Viparita Karani, legs up the wall, but with a crucial modification. Here's how to do it. Lie flat on your back, close to a wall. Scoot your hips as close to the base of the wall as possible and swing your legs straight up so your heels rest against the wall, forming a 90-degree angle. Your body should form a capital L. Now, and this is the key, do not just lie there. Every 60 seconds, perform this cycle. Point your toes strongly toward the ceiling. Hold for 5 seconds. Flex your feet hard, pulling your toes back toward your head. Hold for 5 seconds. That flex is what activates your calf pump. Repeat 10 times per minute for 5 full minutes. This active pumping in an inverted position creates the maximum pressure gradient possible, forcing fluid from your ankle reservoirs up into the larger vessels in your thigh and pelvis, where your main circulatory system can efficiently clear it. 5 minutes of this is the equivalent of a professional lymphatic drainage massage for your entire lower body. Make it non-negotiable. Here's a question most doctors don't address. Why does fluid leak out of your blood vessels in the first place? The answer is capillary permeability. When capillary walls become weakened and inflamed from poor diet, chronic swelling, oxidative stress, they become leaky. Fluid seeps through the walls and into the surrounding tissue. To fix this, we need to go topical with concentrated vein toning botanicals. Mix the following: 5 drops of cypress essential oil. Proven for its venotonic properties, it reduces capillary permeability and helps tighten vessel walls. 5 drops of rosemary essential oil, a potent circulatory stimulant that accelerates local blood flow, combined into 1 tablespoon of carrier oil. Fractionated coconut or sweet almond oil work perfectly. The technique matters. Starting at your toes, use firm upward strokes, always toward your heart. Work the blend deeply into your feet, then up to your ankles, then up your calves. Spend extra time on the lower calf. Stop just below the back of your knee. This isn't just moisturizing, you are physically assisting venous return, delivering anti-inflammatory botanicals directly to inflamed tissue, and stimulating local circulation to carry that flushed fluid away before it can resettle. If you've been told to wear compression socks, here's what nobody told you about nighttime use. Your daytime prescription stockings, 20 to 30 millimeters mercure, should not be worn to bed. When you lie down, blood pressure equalizes throughout your body. High-grade compression in a horizontal position can restrict flow, creating something close to a tourniquet effect. That's the opposite of what we want. What you need at night is low-grade therapeutic compression, 8 to 15 millimeters. These are typically sold as travel or flight socks, and they provide just enough gentle, consistent pressure to prevent your tissue spaces from expanding and reabsorbing the fluid your kidneys are still processing. One critical check. After putting them on, look at the top band. If it leaves a deep indentation in your skin, it's too tight for overnight use. Switch to a pair with a softer, more relaxed band, or fold the band down. Put these on immediately after your vein rub, so you seal in the reduction you've already achieved, especially if you've always been told to stay hydrated. Here's the science. When you drink water, it takes time for your kidneys to filter and process it, and when you're lying flat, your body is significantly less efficient at moving large volumes of fluid. Drinking water right before bed almost guarantees that fluid will follow gravity straight into your ankles overnight. The rule is simple. Stop drinking fluids 3 hours before bed. If you're aiming to be asleep by 10 p.m., your last substantial drink should be by 7 p.m. The only exception? A small sip of water to take your Step 7 supplements. This 3-hour window gives your kidneys time to do their final fluid regulation pass while you're still mostly upright, and gravity is helping, not hindering, the process. This single habit change has a dramatic effect on morning swelling for most people. It is one of the most underrated interventions in this entire protocol. Everything we've done so far has been about draining fluid and physically toning your veins, powerful but temporary if you stop. Step 7 is about addressing the structural damage that caused chronic venous insufficiency in the first place, from the inside. This 2-supplement combination is the most scientifically supported natural therapy for chronic venous insufficiency currently available. HCSE contains a compound called eosin, which has been shown in multiple clinical studies to reduce capillary permeability, essentially sealing those leaky vessel walls. It also promotes the release of prostaglandins that improve venous tone, helping your veins regain their structural integrity. Dose: 300 mg of HCSE, standardized to 50 mg of ASIN. Take with your small sip of water at bedtime. Part 2. Pycnogenol, pine bark extract. Pycnogenol is one of the most potent antioxidants studied in vascular health. It strengthens the collagen matrix surrounding your blood vessels, reduces inflammation, and improves microcirculation. It works synergistically with HCSE. Together, they don't just manage your symptoms, they repair the vascular architecture that's causing them. Dose: 100 mg of pycnogenol alongside your HCSE. Why take these at night? During deep sleep, your body shifts into full repair mode. Cellular regeneration accelerates. Inflammation pathways downregulate. By taking these compounds right before bed, you are supplying your system with the exact raw materials it needs at the exact moment it's most capable of using them. This combination is how you move from nightly management to long-term resolution. Before I let you go, I need to address one habit that silently reverses all of the work we just did: crossing your legs. Whether you're sitting on the couch or lying in bed with one leg draped over the other, crossing your legs physically compresses the femoral artery and vein, the major vessels responsible for returning all blood and fluid from your lower body back to your heart. It kinks the hose, blood stagnates, swelling returns. Tonight, keep your legs parallel. If you're a side sleeper, place a body pillow between your knees. This keeps your knees, hips, and ankles aligned and keeps those femoral vessels open and unobstructed all night long. You've done the work. Don't undo it in your sleep. Here's your complete 7-step nighttime vascular revival protocol by Dr. Michael Kent. Step 1. Magnesium citrate plus cream of tartar drink 60 minutes before bed. Step 2. Contrast ice bath, 3 rounds of hot-cold, finish cold. Step 3. 5-minute legs up the wall active ankle pump. Step 4. Cypress plus rosemary vein rub massaged upward toward the heart. Step 5. 8 to 15 mm compression socks for overnight wear. Step 6. No fluids for the 3 hours before sleep. Step 70. 300 mg HCSE plus 100 mg pycnogenol at bedtime. This is not a trend. This is applied vascular science. The same approach specialists use, broken down into a practical nightly routine you can start tonight. Edema is not something you have to live with. Your circulation is not a fixed, unchangeable thing. It responds to the right inputs, and now you have them. If this video helped you, share it with someone whose legs are swelling. They need this information. And watch my next video right now. I'm breaking down the 3 everyday foods that are silently destroying your vascular elasticity and driving this chronic inflammation. That's the critical piece that makes this protocol permanent. I'm Dr. Michael Kent. Take care of your veins. They are working hard for you every single day. I'll see you in the next one.